It's day 10 of India's 21-day lockdown to stop the spread of the novel coronavirus. I'm Akhil Khadidar, and over the next few minutes, we'll bring you updates regarding the spread of this virus from across India with a specific focus on Bengaluru and Karnataka. At the time of recording this video, 2,876 COVID-19 cases have been recorded in the country. 2,593 people are active reported carriers of the novel coronavirus in India. 210 have recovered since they were first tested. The death toll has climbed to 73. Till date, 66,000 tests for COVID-19 have been done across the nation, among which 8,345 tests were conducted yesterday alone. ICMR has said that the decision regarding rapid diagnostic tests for COVID-19 hotspots is likely to come tomorrow. Andhra Pradesh reported its first COVID-19 death of a 55-year-old man who acquired the virus from his son, who had returned from the Tablighi Jamaat event in Delhi. The state has 158 cases. 2 persons in Bikaner who attended Delhi's Tablighi Jamaat event have tested positive for COVID-19. The total number of cases in Rajasthan stands at 151, including 2 Italians and 16 attendees of the Delhi event. 6 out of 28 from Agra who attended Tablighi Jamaat event tested positive for COVID-19. The number of active COVID-19 cases in Uttar Pradesh rises to 153. 178-year-old person from Godhra who tested positive for COVID-19 passed away last night. 7 more positive cases of coronavirus detected, all in Ahmedabad. Total active cases go up to 77 in Gujarat with 8 dead. 14 more people have tested positive for COVID-19 in Indore, taking the total number of active cases in Madhya Pradesh to 121. With Odisha reporting a fresh case of COVID-19, the number of active cases has gone up to 4. 8 more COVID-19 cases were reported today in Haryana, which 5 are from Gurugram and 3 from Nu. Total active cases in the state till now are 30, while 13 have been discharged. 4 new COVID-19 positive cases have been reported in Assam on Friday. Health Minister Himanta Biswa Sharma tweeted that all these people are among the Nizamuddin congregation. This takes Assam's total active cases to 20. Manipur reported 2 cases, Arunachal Pradesh and Mizoram 1 each. The government has released a tentative list of Tablighi Jamaat attendees from across the world. The majority are from Indonesia, Bangladesh, Kyrgyzstan, Malaysia, Myanmar, Thailand, and Sri Lanka, along with 32 other nations. Meanwhile, the Maharashtra government has said that it has withdrawn permission for a large congregation of the Tablighi Jamaat in the state last month. The congregation was meant to be held on 14th and 15th March. The state had taken the decision in view of the pandemic worldwide, despite the fact that India had not set formal procedures in place. Home Minister Anil Deshmukh said that the precautionary decision had helped to avert a disaster. Karnataka has seen 4 new positive cases today. With this, active cases in the state stands at 114. 11 people have been discharged. The number of deaths remains the same at 3. 111 patients are stable and 3 are in the ICU. Of the 3, 2 are on ventilators and 1 is on oxygen support. Karnataka has tested 4,587 samples so far. Among 4 new cases, 3 are from Belgavi district, who were attendees of the Tablighi Jamaat congregation in Delhi. 1 is from Bagalkot district, whose source of infection is still being determined. Any person who has attended the Tablighi Jamaat congregation Nizamuddin Markaz Masjid in New Delhi, kindly contact the Arogya Saivani number displayed on your screen. Meantime, Prime Minister Modi sent out a video message this morning to the country. He asked Indians to switch off all lights in their homes at 9 p.m. this Sunday and read the Mahabharata in order to strengthen the nation's resolve in fighting the raging pandemic. The Prime Minister said that the people have done well to help contain the virus. Meanwhile, Finance Minister Nirmala Sitharaman echoed the Prime Minister's video message and made an appeal to light lamps. The opposition slammed the Prime Minister's message, saying they had expected him to announce a second financial package in order to bring relief to the people of this country. Meanwhile, the Supreme Court issued a notice to the Center for Payment of Wages by the government to all migrant workers, whether formal, informal, or self-employed, as their lives have come to a standstill following sudden lockdown. The petitioners asserted that the government's inaction during this unprecedented humanitarian crisis violated their right to life, guaranteed under Article 21 of the Indian Constitution. They also pointed out that they were forced to return to their villages during this unprecedented humanitarian crisis. The Supreme Court asked the center to publicize the prices of mass hand sanitizers and liquid soaps essential to fighting the COVID-19 pandemic. Petitioners had approached the court against the black marketing of sanitizers and masks. The Supreme Court has also asked the union government to respond to a plea by a lawyer to provide free-of-cost testing facility for COVID-19. The United Nations High Commissioner for Human Rights, Michelle Bachelet, has stressed that the measures in response to a pandemic should not exacerbate existing inequalities and vulnerabilities. While the UN Human Rights Chief acknowledged the challenge of containing a pandemic in a country like India with its high population density, she also expressed distress over the migrant laborers crisis in India. A committee constituted by the Jammu and Kashmir government has observed that those detained under Public Safety Act are not included in the guidelines issued by the Supreme Court to decongest jails during the pandemic. States like Maharashtra, Punjab, and Uttar Pradesh have released thousands of prisoners held for petty crimes on parole and furlough in the wake of the pandemic. Moving on to see what's happening in Karnataka regarding the COVID-19, Chief Minister B.S. Yedurappa has asked the Primary and Secondary Education Minister S. Suresh Kumar to be the government spokesperson on the COVID-19 crisis management effort. His appointment comes days after Dr. K. Sudhakar was made in charge of the COVID-19 ops in Bengaluru. The move is seen as an attempt to curb the lack of coordination among various ministers in providing COVID-19 numbers. In other decisions, the Chief Minister asked officials to place orders for 2 lakh personal protective equipment in addition to 1 lakh PPEs already ordered. So far, Karnataka has received 1.39 lakh personal protective equipment. 53,000 PPEs are in warehouses. It was also decided that 15 lakh construction laborers will get 2,000 rupees as against 1,000 rupees approved earlier as a contingency measure for now. The Chief Minister also reached out to Muslim legislators seeking their cooperation in identifying those who visited the Tablighi Jamaat congregation in Nizamuddin in New Delhi. Also during the meeting, legislators agreed to convince people of their community to cooperate with health workers conducting COVID-19 surveys. 134 people have been quarantined in Bengaluru's Hajj Bhavan in relation to the congregation. Also during the meeting, the legislators agreed to convince people of their community to cooperate with health workers conducting COVID-19 surveys. 134 people have so far been quarantined in Bengaluru's Hajj Bhavan in relation to the congregation. Karnataka can soon expect its first installment of the State Disaster Response Fund from the center. From its total share of 1,054 crores, the state is expected to receive 410 crores. The state's share of the relief fund is lower than it has been for the past 5 years. Medical and paramedical staff, clinical and non-clinical staff from the Karnataka Health Department who are due to retire in April and May this year will now have to serve until the end of June. The additional Chief Secretary of the Health and Family Welfare Department issued the order earlier today in view of the spread of the pandemic in the state. The Supreme Court intervened in the ongoing scuffle between Karnataka and Kerala over the national highway blockade and asked the center to help the states resolve the issue amicably. After the Kerala High Court ordered for the blockade to be lifted, the Karnataka government rushed to the Supreme Court. Karnataka had earlier closed the national highway to Kerala over concerns that would lead to disastrous consequences. The apex court has said that no state should precipitate the matter at this juncture. Meanwhile, the Dakshina Kannada District Health and Family Welfare Department has directed 8 private hospitals in the district not to enroll patients from Kerala. Healthcare workers continue to be attacked as the police arrested 2 men on charges of issuing threats to Asha workers at Amtadi village in Bantwal Taluk. Bengaluru recorded its second attack on a healthcare professional. A fruit seller assaulted a senior health inspector at Bengaluru's RT Nagar after being told not to sell watermelons. In the argument which flared up between the two, Anis Fatima, the health inspector, was assaulted. Yesterday, there were at least 3 reported cases of healthcare professionals being assaulted. In Bengaluru, thousands of migrants are going hungry due to shortages in food supplies, according to a survey by the Department of Labor. Despite mobilization by municipal authorities and a pool of NGOs, there is a shortfall of 63,000 meals per day. The government continues to change its decisions regarding the free food at the Indira canteens. Today, it announced that it would be discontinuing the service because of misuse. People were found stacking auto rickshaws with nearly 300 packets and taking it away. However, food was previously given at a nominal price would continue as usual. Organizations providing necessary freight and services can obtain a clear pass from the Karnataka police on this link provided in the description below. Before we go, it turns out that a 59-year-old man living in the national capital didn't much like sitting at home. After repeated appeals asking him not to step outside fell on deaf ears, the man's exasperated son called the police. The police have now registered a case. That's all we have for today. Stay safe, stay indoors, and we'll see you tomorrow.